Hi, in this video I'd like to talk about one of the most commonly recommended surgeries for women, which is hysterectomy. So hysterectomy is the complete or partial removal of the uterus. Now, a lot of doctors can recommend hysterectomy for an array of reasons, either for fibroids, endometriosis, adenomyosis, excessive bleeding, even pregnancy. Certain cases they will even recommend hysterectomy. Here at Antai Hospital, we believe that hysterectomy is the most damaging form of surgery that is currently still out there for women. We don't believe that hysterectomy should be recommended to any woman under any circumstances, but there are only two exceptions to this rule. Either the underlying condition is threatening the patient's life, or there is a malignant underlying cause. For example, a cancer-causing tumor that is growing on the uterus that is potentially spreading to elsewhere. Then these types of causes, then we will recommend hysterectomy. Otherwise, we will never recommend hysterectomy because although it can seemingly solve your immediate problem, it will actually bring along several side effects that are actually lifelong with no management methods, and nobody actually really prepares you for this kind of reality. Now let's dive into them. Now in total, there's actually 7 long-term side effects that we've observed in patients that actually have undergone hysterectomy. The first one, which is the most common one, which is a urinary incontinence or urinary retention, which means you lose the ability to control your bladder. You're unable to actually empty your bladder completely. Now, there is a reason for this and why it happens after hysterectomy. The uterus is actually situated in the middle of the stomach here, the pelvic cavity. Now, when the uterus is absent, the bladder here, which sits in front of the uterus, will actually shift backwards because of the absence of the uterus. Because it relies on the uterus posterior wall, anterior wall to actually support itself. Now that there's nothing supporting it, it will actually shift backwards automatically. This is what's causing your urinary incontinence. Secondly is constipation, very similar to how it causes urinary incontinence because of the absence of the uterus. The bladder shifts backwards. Now, because of the absence of the uterus, the rectum or the large intestines is now shifting forward because there's no supporting wall in front of it. In this case, the uterus. Now, when the rectum shifts forward, then there's more space for the feces to accumulate itself, and then now you have constipation. Thirdly is absolute infertility. Now, this is in no question at all, especially for those who go for a complete hysterectomy. You need to think carefully and always get a second opinion before you go for hysterectomy, because you will no longer be able to have kids because you're no longer you have no place to actually have implantation to take place. Fourthly is one of the most serious types of side effect is the bulging of the pelvis. Now, a lot of women who have gone through hysterectomy, they will realize that their pelvis or their stomach, the lower area of the stomach, lower area of the abdomen is actually bulging. There's a lot of pressure there. This is actually caused because of the pelvic organs sagging downwards. This is what is known as a pelvic prolapse. Why is this happening? Is because the uterus is actually an anchor or a foundation of the pelvic organs. And when you remove a foundation of the building, the whole structure becomes very unstable. This is what's happening here. The organs are sagging downwards, causing immense pressure to build up in your lower abdomen. This causes discomfort. It also causes pain during sexual intercourse. This is actually a quite serious side effect, and there is actually treatment available. We'll discuss that in the next video. The next side effect is the significant reduction of climax or orgasm. We do know that main component of an orgasm is actually the contraction of the uterine muscles. And when the uterus is actually removed, your orgasm, although you will still experience some degree of intensity, it will be significantly reduced because there is no longer contraction of the uterine smooth muscles. Next up, as a result of the previous side effect, we very commonly see this social side effects that it does to society, which is marital instability, because of the pain during intercourse, because of the removal of the hysterectomy. The top part of the vaginal canal is also removed. This causes some pain during intercourse, and then furthermore, they don't really experience intense climax anymore. This will cause some marital instability, will cause an increase in divorces. Furthermore, it can also lead to chronic depression. Why does chronic depression happen is because of the removal of the uterus affecting the ovaries as well, causing them to experience emotional instability, increased irritability over long periods of time, and significantly reducing the quality of their life. And then lastly is the onset of menopause. This is a quite important side effect because removal of the uterus actually significantly affects the ovaries because of a removal of certain blood vessels that connect the two together. This will also affect its function. Now, the ovaries have the function of producing a reproductive hormone, in this case estrogen. So when the ovaries are having insufficiency, especially at an early age, they will cause the patient to actually age much more faster. The chronic depression is also root sourced from this cause here, and they will actually experience menopause 5 to 10 years earlier than their counterparts, than their peers. Usually we will observe this usually at the age of 45 to 50, but these women, they will experience it at the age of 35 to 40. All of which can be prevented if you do hysterectomy correctly. Antai Hospital understands that hysterectomy is very rampant today, so we've actually come up with remedies for each of these side effects for our patients who have gone under hysterectomy. For each of these side effects, we have actually come up with a specific treatment that is effective and actually for the purpose of increasing your quality of life. Because after hysterectomy, most patients have decreased in quality of life, and then they have a lot of problems, whether it is health related or family related. All of it is rooted in the cause of hysterectomy.